My name is Dr. Samuel Lin, and I'm here to talk about breast reduction. What I tell people most frequently in terms of breast reduction are that breast reduction is a very common procedure. Lots of people of different ages have breast reduction. It really helps in terms of neck, shoulder, back pain, the shoulder grooving, and also open areas and rashes underneath the breast folds in terms of quality of life. So what does a breast reduction accomplish? Well, and how does it accomplish that? There are two things that happen during a breast reduction. One, the breasts, of course, are reduced and made smaller. And secondly, they are lifted. And so the combination of those two things, the lifting of the breast on the chest wall as a reduction of the breast tissue, really help in terms of the symptoms that are decreased in terms of neck and shoulder and back pain. As the breast volume is reduced, what happens is an exchange for incisions. So the breast reduced and they're in exchange for incisions that go around, typically around the nipple, down as a vertical line and underneath as a anchor type of incision. There are other types of breast reconstruction incision patterns, but most commonly there are ones that involve ones that at least go around the nipple, plus or minus an up and down incision, and plus or minus sort of an underneath type of anchor type of incision. The underneath type of breast fold incision is typically under the breast, so it's less visible from the front. And what happens is the breast tissue is removed and everything needs to heal. The nipple sensation can do one of three things. It can stay the same, it can increase, become a little more sensitive for a time, it can decrease, become a little more numb for a time afterwards. There's a very rare chance that the nipple doesn't survive when we move it from a lower position to a higher position on the chest wall. It happens extremely rarely, but I always mention that. And so people talk about, well, when and how do I know when my final breast size will be? There is swelling after the surgery. Swelling takes about 6 months to go away. The recovery time for a breast reduction is about 6 weeks' time. And I tell people about several things in terms of the size, of what size people will be afterwards. Well, number one, we want to remove enough breast tissue to make a difference, of course, in terms of neck, shoulder, back pain. We want to leave enough breast tissue to supply the nerve supply and blood supply to the nipple. And thirdly, we want to leave enough breast tissue and to fit a person's body frame. There is swelling, again, that takes for 6 months' time, and so in terms of cup size, it's hard to talk about cup size because every company is different in terms of the cup size that they design, and even within the same company, there are variations in terms of cup sizes. So it's sort of hard to talk and really nail down a specific cup size that people will be afterwards. But all the breast tissue that is reduced is weighed, of course, in grams, and also it's checked by the pathologist to make sure that there are no funny-looking cells in the breast reduction specimen. Prior to having a breast reduction, if patients are over the age of 40, it is imperative that people have a mammogram before having a breast reduction at that age group. And so 6 weeks' time of recovery, and the incisions will heal. Sometimes there might be a little bit of an opening at the bottom, which takes longer to heal, but it does heal. And so after everything is healed, then people can go back to their activities of exercise, swimming, once everything is healed, and certainly, hopefully they'll feel better afterwards, and many times they do. I hope that's been helpful. Thanks very much.